Trevor Mokel, and welcome to the Mendocino County COVID-19 update. Today, we are pleased to be joined by Mendocino County Health Officer, Dr. Andy Coren, who will give us an update on the COVID-19 status of our county. After that, we'll open it up to take a few questions from the media concerning the COVID-19 incident. Questions are limited to 2 questions per media outlet in order to preserve the schedule of our staff. If time allows, we will also take questions from the public. If you're a member of the public, please leave your question in the comment of this video below, and we'll do our best to address it. Now, beginning with the health update, Dr. Coren, you have our attention.
Hello, everybody. Yes, we have changed to the yellow tier, so be happy, but be cautious. Now is when we have to vaccinate. Let's go over the data first from April 29th. It's important to notice that worldwide, India has surpassed the United States in daily cases with over 330,000 new cases per day, though they still have less total cases and less total deaths. But they are in the news because of the near collapse of their healthcare system, which we came close to having here in California last winter. The United States and other countries are beginning to help, so this pandemic is far from over. And with this rate of growth in India, we'll all have more of a threat of more serious variants, and I'll get more to that in a minute. Nationally, the United States coronavirus cases are 32,235,827, and the deaths are 574,383. This is still almost 3 times the number of deaths that are currently in India. There have been waves in Michigan and Minnesota, the New England states and Northeast, Puerto Rico, and now Oregon to our north is suffering a significant increase in their case rates. California cases now number 3,636,235, and the deaths amount to 60,362. In Mendocino County, we have 2.42 cases per 100,000 per day, and that again is a 7-day average over 7 days ago. The test positivity is 1.2% compared to the state 1.4%. These are very low numbers. Total cases in Mendocino County have numbered 4,024, of which 1,996 have been from our Hispanic community. That remains lower than 50%. We currently have 31 people in isolation and 33 people in quarantine. Our deaths now number 48 in this county. Most recent was a 66-year-old Native American man. He had many comorbidities, and we mourn his loss. So in the yellow tier, the changes in summary mean we have higher capacities in many situations. I hear a lot of frustration about the restrictions, and now I'm hearing a lot of anxiety about moving to the yellow tier. I want to let you know that I share those concerns, and we need this time in the yellow tier to learn our own best behaviors and practices before the general guidance is withdrawn beyond the blueprint as planned in June. But we are not beyond this pandemic, and if there are outbreaks while we are in the yellow tier, we could have to return to the orange or the red tier. Let's review some of the most common guidances that have been changed. And I'll summarize these by just saying that they're higher capacities. But again, private informal gatherings are allowed up to 100 people that can attend outdoors. Indoors is still discouraged because there's high transmission, but it is permitted without food or drink up to 50% capacity. It is much safer outdoors. Private events, which are meetings, conferences, are more formal with a defined guest list. These are permitted outdoors and indoors with proof of vaccination or negative test. With proof of vaccination or negative test, the capacity has increased. Indoor seated live events, for example, performances, with weekly worker testing and designated areas to eat with maintaining 6 foot of distance are allowed with increased capacity. And again, bonus capacities if all are tested or vaccinated. Outdoor live events such as sports and performances, and at this time of the year, graduations are allowed with assigned seating. They are restricted to in-state individuals. Again, the capacity is increased. I'm not going to go into those details. Recent CDC masking guidance has been updated, and the CDPH, California Department of Public Health, aligns with fully vaccinated people may go without masks outdoors unless in crowded outdoor events. Close contacts who have no symptoms, who are fully vaccinated, no longer have to quarantine or test unless they have symptoms, in which case they should see their provider and test. This does not apply to those in healthcare settings or other workplaces subject to the OSHA rules or living with vulnerable people. Those who may be immunocompromised should consult with their healthcare provider for further guidance. Recent travel guidance for fully vaccinated persons has also changed. People should travel with masks always, whether in the air or airports or travel hubs such as railway stations, buses, and so on. For domestic travel, you do not need to test before or after or quarantine unless required by local health authorities. International travelers do not need testing on departure unless it's required by the destination they are going to. Upon return, they must have a negative test or proof of recent infection before they board, and they should test 3 to 5 days after return, but no need to self-quarantine. Again, more and more reasons for people to be vaccinated. Outbreaks in Mendocino County, we have none that are open at this time and no active school cases. Testing is now available, but it has fallen off to a very low level, leading us to a point where we may not be able to find index cases in time to control outbreaks. So keep testing. I recommend once per month, whether vaccinated or not. The Ukiah Fairgrounds is open every Sunday through Thursday from 9 to 5 p.m. and Fort Bragg Veterans Hall is available every Tuesday from 9 to 5. The travel team is making its rounds, and today they will visit Point Arena and Boonville, and next week they will be in Laytonville and Willits. Consolidated Tribal Health is also having some testing today in Willits. People with symptoms who need testing should not go to these surveillance sites, but should go to their clinics or providers on weekdays in order to protect those people who are employed for this testing. Variance is a very important concern at this point. We just received notice that California surveillance testing has found a variant B117, the UK variety, here in Mendocino County last month. The UK variety B117 is 50% more transmissible and is more virulent. The prevalence has grown significantly in California. The state is doing much more surveillance testing now, up to 11% of all positive tests. They are working on reporting back to counties more rapidly and other ways to refine this data. But I want to remind everybody that this B117 variant was responsible for the UK surge and is a very virulent and very transmissible variety. So this is a new development that is a serious threat, and we should see it as more of a stimulus for all those who have been hesitant or have been holding out for whatever reason to get vaccinated and get vaccinated as soon as possible. And the importance of this should be emphasized that our current vaccines are still active against these variants and all of the variants and original varieties of COVID that we have here in California. Vaccinations. There was a lot of interest last time in the phenomena of having infections after vaccinations, and some mistakenly interpreted that to conclude that the vaccinations are somehow less effective. To the contrary, we are seeing much less than the expected with the numbers that we have vaccinated. Here in Mendocino County, with almost 30,000 fully vaccinated people, and for a vaccine with 95% efficacy, which means 5% would be expected to get infected, or 1,500 people. Instead of this, we've seen just 17, much less than 1%. And for that reason, we are not referring to these as breakthroughs anymore, but the state and the federal government are now calling these post-vaccine infections. None have needed hospitalization or died. Few have any symptoms. These are all the more reasons to continue vaccinating. New research from Chicago skilled nursing facility outbreaks showed that of those who were vaccinated, only 0.2% got infected and only had mild effects, compared to 15% of those who were not vaccinated. Most of the people who are not vaccinated tend to be staff, and they think that they're healthy in other ways and they're doing all of what they should be doing. And so they're holding out against getting a vaccine. And I want to say it's not safe for them, for their patients, their families, or their friends. Let's move on to the Johnson & Johnson one-shot vaccine. Again, 2 weeks ago, Johnson & Johnson one-shot vaccine was put on pause due to the very rare occurrence of blood clots with coagulation disorder, now referred to as TTS. This occurred in mostly women from 18 to 50 years old. Over the next week and a little bit more, the FDA, the CDC, ACIP, and Western State Scientific Group studied this thoroughly and found a few more cases, including a couple more strokes. This rate is less than 2 per million doses. We have had none in Mendocino County. While this issue has been interpreted as a vaccine problem, it is actually a testament to the commitment to safety and to our ability to detect this tiny number of side effects. The recommendation now is that we can resume offering the J&J or Janssen vaccine with new vaccine information being provided to all the patients and all people having a choice. All providers in Mendocino County have been alerted to the potential symptoms of people presenting with this syndrome and the need for a thorough evaluation and possibly referral to an emergency room if someone presents with this. The vaccine supply is expected to increase in the next 2 weeks. However, we are seeing a significant decrease in people signing up for the vaccines here in Mendocino County and throughout the state. Our partners have been signed up with Blue Shield, the third-party administrator, and in the process of getting their vaccines from the state, with only 2 clinics still needing to get their vaccines from the county. My Turn is much improved and more features for county events, and our partners are starting to use it. Again, myturn.ca.gov is a way to get appointments online, or the telephone number is 833-422-4255, and this is available in English and Spanish. Also in English and Spanish, services are available from the county by dialing 707-472-2633, and NCO also has a line, 707-467-3239, or you can text them at 707-209-7161 and put in the body of the text NCO VAX, VAX. These phone numbers are all available for assistance with a person to make these appointments. Eligibility now is anyone over 16 years old. Of course, if people are between 16 and 18 years old, Pfizer is the only vaccine that is currently approved. The others are in the various phases of being tested, but they have not yet applied for approval. We have taken down all barriers for verification. We require only a name and an address, and will vaccinate people out of the county. It is free and it will not affect eligibility for citizenship or Medi-Cal, and we also accept walk-ins. We have been vaccinating the 16 to 18-year-olds and their family members, partnering with the schools. We are hoping for the approval of the Pfizer vaccine for the 12 to 15-year-olds in the next 1 to 2 months, and looking forward to vaccinating these children along with their usual childhood vaccines. There may be vaccines available for younger age children toward the end of the year. We're continuing to offer some larger events, but we are providing more smaller events and traveling teams for smaller groups. We continue to outreach to agricultural workers and food industry workers, as well as the Hispanic community, and we are now planning events together with the Native American tribes in Hopland and Sherwood Valley. To support all of this, we're continuing and increasing our outreach with education on social media, radio, and flyers, as well as planning in door hangers, and all of this in English and Spanish. Getting on to the vaccine data for our county, keep in mind that does not include the federal government allotments to Indian Health Service, Veteran Affairs, or the prisons. Total Mendocino County vaccines administered equals 68,582. As of April 29th, over 55% of eligible citizens have had at least one dose. 72% of those over 65 have had at least one dose. 68% of those 50 to 64 years old, 45% of those in the 18 to 49-year-old age group, and 21% of our 16 to 17-year-olds. Our equity quartiles are doing very well. In the first or least resourced quartile, we have 51% vaccinated, at least partially. And in the second quartile, 56% are at least partially vaccinated, and 53% in the third quartile. Mendocino does not have any significant numbers of fourth quartile residents. We have at least partially vaccinated 57% of Caucasians, and 40% of those in the Hispanic community. Upcoming vaccine opportunities this week, we will be having both first and second doses of Pfizer and some Moderna, as well as some Johnson & Johnson. County events we have planned, we had a Moderna first dose clinic in the morning and Pfizer second dose clinic in the afternoon and early evening. That was yesterday. On Saturday, May 1st, we'll have Pfizer available at the Ukiah High School for students and their families. And this is being offered by the county and worked on by the school and the city of Ukiah. Next week in the clinics, RCMS is going to have vaccines available on Saturdays and in the clinics at their visits, and they are using Pfizer. On May 1st, they'll have second dose clinic, and on May 8th, another second dose clinic. Mendocino Community Clinic has declared May is for Moderna. And on Fridays from 5:30 to 7:30 each Friday night, there will be drive-through clinics at the clinic. Anderson Valley Health Center will have a vaccine clinic on Thursday for second dose Moderna. That will be at the high school. And if people request, they will be able to get first doses and also drop in there. Mendocino Community Health Center has Johnson & Johnson in the office and are offering that as part of the workflow for their patient visits. Consolidated Tribal Health Project will have Moderna first dose clinic on Wednesday, the 5th of May in the morning, and second dose in the afternoon. Adventist Health Ukiah Valley does have the vaccines available for their patients. They are requesting for all their patients to sign up at their appointments, and they're scheduling them for a combined clinic later. Bechtel Creek is offering Pfizer second doses on Tuesday and Friday. Please call first so they can align 10 people so there's less waste of those vaccines. And some Moderna are also available if requested. In Laytonville, they're having Tuesday and Friday clinics regularly. Second dose Moderna, 10 a.m. to noon by appointment or walk-in. Round Valley Indian Health, scheduled on May 15th, 11 a.m. to 2 p.m. First or second dose drive-throughs, and walk-ins are also welcome. So in summary, we should be proud to achieve the yellow tier status. Our county has earned it by following the guidance, restrictions, and getting tested and vaccinated. This has been painful for many. We have come together as a community of partners, including the health department, our hospitals, clinics, emergency medical and first responders, cities, schools, religious leaders, and many, many others. At the same time, we must continue to be vigilant and follow the remaining guidance to prevent more spread or a new wave or even a surge. The pandemic is raging in other areas in the world, and surprisingly, even here in the United States, as close as Oregon. The UK variant that is more contagious and more virulent, we have found here now in Mendocino County, and it provides a new urgency to get vaccinated as soon as possible. So as always, we should be following the guidance for masking, distancing, hygiene, ventilation, being outdoors, and testing. Of course, take into consideration the advantages if you are vaccinated, where you can be closer to other people and be outside of crowded spaces without masks if you're completely vaccinated. But our major defense at this time is vaccinations. This is prevention. These vaccines are safe and effective. And if you are not vaccinated, you're at high risk, even if you're following all the recommendations. So please get vaccinated. There are openings at our events, so the vaccines are free and accessible. Please don't wait. And that will end my report for this week.
Thank you, Dr. Coren, for that report. Now we're going to open up to some questions from the media. First, leading us off will be Mendocino Voice.
Okay, how you doing, everyone?
Hi, Adrian.
Dr. Coren, I'm wondering if you could describe, talk a little bit more about new variants that are popping up. I know I think there's one in India and one in Brazil that I know of. If you could talk a little bit more about those variants and if we've seen those in California yet.
So the main variant that we have in California is the West Coast variant, or the California variant, which those of us from California don't like to refer to it as. That one does spread a little faster. It's 20% more contagious than the native COVID virus. It does not have, as far as we know, more virulence. It is not more severe, and it is not resistant to the vaccines. So vaccinations completely protect against that. The other variant that has been seen in California, and as I said, here in Ukiah, is the UK variant, or the B.1.1.7, and that does spread significantly faster, not 20%, but 50% faster, and it is more virulent, though it still is responsive to our treatments, such as the monoclonal antibodies, and also to vaccination efforts. The virus that is raging in Brazil is the P1 variant, and it spreads faster and it's more virulent. I am not sure. I don't think that it's, I don't have it here, resistant to the current vaccines that we have. The South African variant is resistant, though it was found to be sensitive to the vaccines that we have now. As far as the Johnson & Johnson, the mRNA vaccines were tested late there before I think before that variant was found. So it's a little questionable. I'm not quite sure whether it is sensitive, but the South African variant has not significantly hit the Western Hemisphere. The other variant that we're seeing a lot in the news is the Indian variant, and that's sometimes referred to as the double variant. It has some characteristics of the UK variant, so it is more transmissible, and it has some characteristics of the South African variant, and so it is more virulent. And we don't know yet whether it has significant resistance to the vaccines that we have, because it shares mutations from both UK and South Africa. So that is still being looked at. But clearly, it's raging and creating an inferno of a pandemic in India. So we have to be worried about that. Did that answer your questions, Adrian?
For your follow-up, Mendocino Voice.
Yeah, that's clear. But I was just to clarify, is still part of the first question, is have we seen the Indian, has there been testing from the state lab showing that we've seen the Indian variant or the South African variant, any of those other Brazilian variant in California? That's just to clarify for the first question. And I'll go ahead and ask my second question, which is if you could update us on the status of the Vallejo lab that Mendocino County is participating in the study on.
Yeah, we actually participate in the Solano lab, and so they are, they're a full county lab, and they are in the process of setting up and finalizing their operations around their whole genome sequencing. Oh, let me go back. I think that there have been a case or two in Southern California of the P1 variant from Brazil, and there may have been a case or two from South Africa, but they were contained, mitigated, and as far as I know, some time has passed, and we haven't seen the emergence of more of those.
Thank you. Next question is going to be from Mendocino Action News.
I'm sorry. Just to clarify, you were setting up the Mendocino County. What is the status of the whole genome testing at the Solano lab? How far along is that? And will we be able to get more of those whole genome tests happening in Mendocino County, out of Mendocino County, rather?
Yeah. What's happening now, I've made many calls to the Solano lab, to VRDL, which is the major lab that has been doing the whole genome testing, and to the Perkin-Elmer lab, which is the new state lab that's been up for several months. The Solano lab is adding on the whole genome sequencing, and they're able to do it, but the results are not final. So as I understand it, all of their tests also are being run through the CDPH lab to confirm results. However, they are tied in to the new state system of COVID-Net, which is a state system to increase testing of variants throughout the state. And that is working from Perkin-Elmer Lab and VRDL, but also working with many academic institutions and other county labs that are adding on more and more the whole genome sequencing. They are at the point where they are going back to all of the positive tests that were done starting in January to do the sequencing on any of the samples that they have, that they can run through that to give us a better understanding of what's been happening with these variants. And they're doing 11%, 10 to 11% of the positive tests that they're getting in through Perkin-Elmer. they have been also improving their operations so that their goal is to be able to get the results out within a week. In certain special cases, they may be able to get results out in a day, but for the most part, the results come in about a month later. And that's what happened with this most recent notice that we got about the UK variant. So things are slow. This is not a test that you would use clinically yet to mitigate or to treat someone, but it does give us a sense of what's happening in our community. I had tried to set it up through the Solano lab, and they are getting up their whole genome sequencing, but they're doing most of their tests and having them validated outside. So it didn't work out as an easy fix for doing the whole genome sequencing for our community. And if we have someone that we do need to do whole genome sequencing for, we can coordinate that through CDPH and VRDL and highlight and request that particular sample for clinical reasons get whole genome sequencing. So that's where we're at this point.
Thank you, Dr. Coren. Next up is the Mendocino Action News.
Hello. Thank you for having this meeting. It's nice to see that we're in the yellow tier. I hope that means that, that you guys have all done a great job and hard work, and our community's done a lot of hard work to get there. So my question, one of them, if you could a little bit elaborate on graduations. I know you said a sentence or two, but if you could talk a little bit more about that. Are you meeting with superintendents? Are you guys discussing the layout? Seeing that last year was canceled or modified?
The state has released guidance for graduations, and the schools are working with those. And if they have questions, then I can review them and answer. But basically, it is an outdoor seated event is how it's being treated, and there will be a need for masking and spacing, and they will have to decide. There are a number of ways that they can work it, but I think most of them are having their events as usual outside with more spacing. There'll be some restrictions of people who can come based on their the capacity of wherever they have it, and so that's what's happening with the graduations. They're doing their planning right now.
And for your follow-up.
My other question. Seeing that, okay, there's some vaccines starting into the year for younger kids that I missed the part if you said they will start them, because I know we're doing testing now on younger children. I also saw that a lot of the UCs are trying to get it mandated for vaccines prior to people, returning in the fall. Do you see that actually, coming too?
There are problems with that because the vaccines that we have right now are their emergency use authorizations because they're not federally the FDA approved, so none of them are approved. And to ask or require vaccinations before attendance to anything is very difficult and would come under scrutiny, I'm sure, up to the Supreme Court. So they're talking about it, and there are other places who have talked about it as well. But I think mandating vaccines has not been what our federal government or state government has wanted to do, and doing so would present a lot of constitutional problems.
Thank you. Next up is going to be KZYX.
Okay. Yes, hello, thank you. So it sounds like in the yellow tier, can you hear me?
Yes.
Okay, I still had a notice on my screen. Okay, it sounds like attendance at various events in the yellow tier can be higher than 50% with proof of vaccination or negative test. And I'm wondering what that looks like logistically, and who's going to take the lead on coming up with a system to require that kind of proof and monitor it?
Well, yes, there are a number of capacity limits that have gone up if people show that they are tested and negative, and if they have been vaccinated. I'm looking through the blueprint right now, and I'm seeing the maximum is still 50% on a lot of them. But I do know that there's a bonus so that it can be bigger than that. In fact, outdoor live events that are seated can be 67%. So I just found one, but the others can also bonus if they are all vaccinated or tested negative. How does that get translated into reality? Whoever's holding those events are required to check people's proof of vaccination or proof of a recent negative test. There is in the state and in the country and internationally some interest in developing vaccine passports. I'm sure you've heard, and it is a hot topic. There are questions of privacy and questions of fraud that would have to be dealt with those kinds of cards. And so I know Imperial County is trying to arrange something like that, but we don't have a vaccine passport at all in this country that I know of, but it is something on the horizon probably. So the quick answer to your question is it's up to the organizer of the event.
And for your follow-up?
So that sounds kind of like an honor system. Like environmental health or code enforcement is not going to be patrolling outdoor concerts or movie theaters.
I didn't hear the part that you said after honor system.
Oh, it just a clarification. It sounds like environmental health or code enforcement or law enforcement or anything is not going to be patrolling events where where there's a greater allowance of participants if they're vaccinated or tested.
I don't know what will happen in other counties. I think it would be a nightmare for code enforcement to go back and forth among the aisles or stand in the lines and check people. We will probably do what we've done with other guidance, which is to say, you have to have people out there checking their paperwork for their recent test or their proof of recent testing and their proof of vaccination. So it's not exactly an honor system. We do expect that the organizers of the venues are really checking for the safety of their clients and the public. I think if we found that there were egregious problems, code enforcement could be called to investigate.
All right, thank you. We don't have any questions from the public, so I'm going to do one more round through the media, and you can ask one additional question. Mendocino Voice, you're up.
Yeah, I want to piggyback on what Sarah was saying there in terms of, I understand that the county and the state and the feds aren't mandating any specific kind of vaccine passport at this time. And it sounds like they haven't even created a guideline, but maybe you could offer like a best practice, if not a rigid guideline, a best practice. What is something people could offer as a proof of vaccination? What is something that venue operators, restaurants, bars were listed in there, any number of venues, would be sensible for them to accept as proof? Let's put it that way. So it's not like a rigid law, but just, your guidance.
Well, for vaccinations, they can bring their vaccine card. They can bring a picture of their vaccine card. They can bring a note from their provider that says they were completely vaccinated by a certain date. So that's a very checkable piece of hard evidence, and that's what's being recommended. The same thing is true for testing. Testing should be, if it's a PCR test, within 3 days. And if it's a Binax or I should not use the brand name, but if it's an antigen test, it can be done the same day. And the operators should be looking at those pieces of paper before they enter.
Thank you. Next is going to be Mendocino Action News.
Okay. There's a lot of pop boxes there. Okay. Let me just get back. There's been a lot of changes regarding vaccinated individuals. You know, we went from the possibility that they could still transmit the virus. I think you said that's still cautionary with vulnerable family members or work environment. Then recently, you know, you can have the mask off outside or with strangers or small crowds. And then just now you said versus before, there is no need to test anymore unless you're in healthcare or other work environment. Could you give a quick summary on the actual changes regarding vaccinated individuals?
So from the point of view of the California Department of Public Health, people can spend time with other fully vaccinated people, including indoors, without wearing a mask or physical distancing. They can spend some time with unvaccinated people from a single household who are at low risk of severe COVID disease without wearing a mask or physical distancing. So that would be a gathering of mostly vaccinated people, but there may be another single household where someone may not have been vaccinated, and that would be okay to be in that kind of a gathering. They can refrain from quarantine, and they can refrain from testing following a known exposure if they are asymptomatic. And this is not necessarily the case if it's a workplace setting. So in healthcare settings and in workplace settings, those are governed by a different set of rules. And in workplace settings, it's OSHA, Occupational Safety and Health Administration, or Cal-OSHA. And in hospitals, there are healthcare worker recommendations because they're in contact with more vulnerable people. They should continue, people who are vaccinated, to wear a mask, a well-fitted mask, and physical distancing if they're around vulnerable people. And if they're, you know, if they're with non-vaccinated people or groups who are both vaccinated and unvaccinated, with the one exception I mentioned. People who are vaccinated should continue to wear masks and continue to physical distance and adhere to the other measures when visiting with unvaccinated people, especially who are at risk for severe COVID disease or have an unvaccinated household member who's present in the household. Let me just try and get rid of this distraction. Let's see, and they should get tested for sure if anyone who's been vaccinated is experiencing COVID symptoms. So they should go to their clinical provider and consider getting tested. And if they are positive in their testing or their provider suggests that they may have COVID, they should follow all the guidance around isolation and excluding from high-risk settings. Does that answer your question?
Sorry, there wasn't allowing me there. Yeah, thank you very much. That was very clear.
Okay, good.
Thank you. All right, next is going to be KZYX, and I think I might have snubbed them on one of their questions. To clarify, they might be able to ask too.
Yeah, I was going to bring that up because it ties into my next question. I really think that being muted in between the questions insults our professionalism and treats us like we're class clowns, disrupting a proceeding. And I would like to know when we are going to be allowed to participate in person in our local politics and informational sessions so that we can actually have a level of meaningful participation with our leadership. Thank you.
Just for clarification, people have been able to unmute themselves throughout this conversation.
So Sarah, I think that it will depend on our level of contagion in the community, and that as soon as we hit June 15th, we're going to have to make a decision whether the overall level of contagion within the community is low enough and the protection in the community is high enough that certain venues will be open to face-to-face meetings. We want to get back to that point. And here in Mendocino County, I know that our CEO and Board of Supervisors have a graded opening plan, and they're thinking in terms of June as well, before we move to a less restrictive entry into our public buildings. So we want the democratic process to continue, and face-to-face is a good way for us to be meeting, but we also want to protect the members of our community against this pandemic. So again, it's been a balance. We don't like to I certainly don't like to put restrictions on people, but we're doing this because it protects everybody, and we still think there's a measure of danger to everybody if we're mingling vaccinated and unvaccinated people. But the sooner we can get to being together and face-to-face is the sooner we can get vaccinated and get our numbers up higher, where we feel more confident that there will be less contagion during these kinds of meetings and gatherings. Did that answer your question, Sarah? It's not a hard date. I'm not giving you a hard date.
Yeah, I would like to add that I have been trying to unmute myself and failing, and I would really appreciate more of an attempt to have more meaningful interactions with all of our leadership, because a lot of times we're asking questions and we get this kind of ring around the rosy and sent to people who don't know the answers. And I feel like the pandemic has been used as an excuse not to give people a lot of information in a timely way, and I would like that to be over.
Sarah, I appreciate that. I hope you'll be patient, because there's a lot of information we don't know, and we're finding it out as we go along. For example, we really don't know the duration of the immunogenicity of the vaccines. And so we're hitting 6 months now, and the fact that that they are letting us be together and finding that the vaccines are lasting more than 6 months is, we're discovering this as we go. We are all in this petri dish together. Let me put it that way. And we're trying to go cautiously so that we don't have a rebound. There are threats around the corner, and we're trying to open it up as soon as we can. We really hear you, and these are discussions that we're having in the state calls and within the county as well. But I think we need a little bit of patience, and that's not easy when we've been in lockdown for more than a year. So I appreciate the questions and the concerns, but I hope you'll appreciate that we're trying to be cautious for the safety of the community.
And I hope that we can consider the safety of our democracy as well. Thank you.
Good.
Thank you. We also have one question from the community that came in. They would like to know how long the vaccines last for.
Well, I was just talking about that a second ago, probably when that person was asking the question. We are now looking at those people who are in the phase 3 trials and had the vaccines available to them 3 months before they were available to the rest of us. And so they were the people who we were looking at then to see if it was safe and effective. And their vaccine duration is a little over 6 months now. It's coming on to I think 8 or 9 months, and we're seeing the same kind of immunity at this time after those vaccinations in those people. So as we go forward, we'll be able to say more clearly how long the vaccines are lasting. And really what we want to know is, what's it safe to do when you've had these vaccines? And we don't know that yet. Nobody knows that. It's not something anyone's holding back. We're trying to use good scientific principles to assess that. It's not only the immunoglobulins and levels of various tests that are there. That doesn't tell us what the real immunity in the community is. And I think that's the question you're asking, not just what it would be in a laboratory. So until we see enough experience going on to 9 months and a year, it looks like those are our next goalposts, and we're trying to make those as we live that experiment. I think another question is, will we need boosters? Well, we'll need boosters when the immunogenicity, when the immunity wanes, and we'll see that in population studies, probably in those people who were in the phase 3 trials. Will those boosters be the same as the current vaccines? It depends a little bit on the variants and their susceptibility to the current vaccines. So the answer is, I don't know, but we're looking and we're trying to follow that. I hope that's an adequate answer for you.
Thank you, Dr. Coren. That sums up today's COVID-19 update. Thank you for joining us. I'd like to give Dr. Coren the opportunity to give his concluding comments.
Well, I think everybody on this call and whoever will be listening and reading what you all are writing and broadcasting understands that this has been a terrible year. We've been shut down and going through our own personal pain, some people more than others, some people losing loved ones. It's a very severe epidemic, and it appears that the vaccines are helping us emerge from that threat. It's certainly looking good at this point in Mendocino County, but around the corner we have some significant challenges to that success. And one is there's more gatherings, and the other, and we have holidays coming up, July 4th, Memorial Day, the whole summer and spring and fall where people travel and visit. And we have variants. And the variants are here in the United States and here in California and here in Mendocino County, and they are a huge threat and a challenge up ahead. So far, our vaccines are handling them very well. The problem that we're having is getting more people open to sticking out their arms and getting vaccinated. We need people to tell other people, I had the vaccine, it didn't hurt, I didn't have severe side effects, I'm being protected, I can now do more because I'm vaccinated, our community is safer, you'll be safer, you'll protect your families and your friends and the people you work with if you're vaccinated. Let's get everybody vaccinated. Now is the time. So that's what I'll leave you with.
Thank you, Dr. Coren. Our next update is scheduled for May 14th. Please continue to follow Mendocino County Public Health on Facebook and all COVID-19 updates. Thank you for joining us.
Yeah.